Alright guys, so welcome to part 2 of the video. If you missed part 1, make sure you go check that out. It was really interesting. Over there we were talking about we were comparing the scope of practice of a CNA to an LPN, really trying to break this mystery of whether or not LPNs are glorified CNAs. In this video, we are also going to be talking about the same thing, but we are going to be comparing the scope of practice of an LPN, the tasks that LPNs are able to do, and we are going to compare that to the scope of practice and the tasks that RNs are able to do, to really look at the similarities between the two and what the differences between the two really is. So, I read the scope of practice of a licensed practical nurse according to the Board of Nurses where I live. Like I said, there may be little differences depending on where you live, but it's usually pretty standard everywhere. So we're going to go over that again. I'm going to put a picture of the scope of practice of both of them. I'm going to put the LPN scope of practice right here and the RN scope of practice right here so that you guys can pause this video, read the two, because I want you guys to really pay attention and look at that one magic word that is different. When you guys pause this video and you guys look at the difference between the two, write down what that one word difference is down below in the comments. I want to see if you guys are really paying attention. At the Article 37P of the Professional Code, the field of practice of a licensed practical nurse is described as follows: to participate in the assessment of a person's state of health and in carrying out the care plan, providing nursing and medical care and treatment to maintain or restore health and prevent illness, and provide palliative care. Okay? Did you find that one word difference, right? I'm gonna read the other one. I'm gonna list it down here, but I put both of them before so that you guys can pause the video and take a look at it. I'm gonna read for the RNs and then we're going to see if we can figure out what that one word difference is, that one keyword. So for RNs, it says, the practice of nursing consists in assessing a person's state of health, determining and carrying out the nursing care and treatment plan, providing nursing and medical care, treatment in order to maintain or restore health and prevent illness, and provide palliative care. Did you guys find that one word difference? That one word difference that really differentiates LPNs to RN. And that one word difference is participate. You see that in the scope of practice of an LPN, it starts with participating in the assessment of a person's state of health and in carrying out the care plan. And for RNs, it just says to assess a person's state of health, right? So as an LPN, you are participating in the assessment as opposed to actually doing the assessment. And that is really the big difference, right? With the one extra year of school that RNs get, they end up developing these skills that are a little bit more advanced, which allows them to do nursing diagnoses. As LPNs, we are not diagnosing, we are not doing any type of diagnosing. We are collecting data and sharing that with the RN that we are paired with. The RN there makes the actual decision after that. However, depending on where you work, there may not be an RN working with you. If you work in a place like where I work independently. I don't have any RN to give me an okay for everything. I do everything by myself. So really depends on where you work. But if you're working in acute care where you're working with an RN, then you may have to report to your RN. You guys are working very closely. You guys have very similar scope of practices, except that as an LPN, you are collecting data and sharing that with your partner, with the RN that you're paired with. You are not actually making the assessment. You are participating in the assessment. Now, for RNs, the first thing we see, the following activities of practice of nursing care reserved to nurses or to registered nurses. 1, assessing the physical and mental condition of a symptomatic person. Are LPNs allowed to assess the physical and mental condition of a symptomatic person? So the key word here is assess. Like I said, we are not it's really stupid, and it's very, very tricky, because when you're collecting data, when you're doing a head to toe, you are assessing. So in my personal opinion, I would say that yes, LPNs absolutely do assess the physical and mental condition of a symptomatic person. When you go into a person's room and you do a head to toe, you are assessing. It's a head to toe assessment. So LPNs are definitely allowed to do that. Now, the second one for RNs is providing clinical monitoring of the condition of a person whose state of health is problematic, including monitoring and adjusting the therapeutic nursing plan. So I would say yes. Also, LPNs are able to do that, except the only thing that they're not allowed to do in this case is adjust the therapeutic nursing plan, because it's not really our job to make the therapeutic nursing plan. The TNP and the care plan are made by the RNs. We can follow it. We can add little things to it. Sometimes there are some exceptions, but for the most part, the TNP and the care plan is the responsibility of the RN. 3, initiating diagnostic and therapeutic measures in order to a prescription. Can LPNs do this? Absolutely. This is what I'm reading, by the way. This is the scope of practice of an RN. These are the following activities of practice of RNs, right? But I'm reading all of them, and I'm telling you guys which ones LPNs are allowed to do. So, initiating diagnostic and therapeutic measures according to a prescription. Now, the only thing about that one that I would say no to is initiating diagnostic measures, because like I said, LPNs are not making nursing diagnoses, right? But we are taking therapeutic measures, right? So it's a yes and no. It's a half and half, 50-50 for that. Initiating diagnostic measures for the purposes of screening operations under the Public Health Act. So for that, I would say no. LPNs are not doing that. We are not initiating diagnostic measures for the purpose of screening operations. We're not doing that. That's a no. 5, performing invasive examinations and diagnostic tests according to a prescription. So for that, I would say yes. Oh my God, I lost it. So we are performing invasive examinations and diagnostic tests. We're collecting the data, right? So we can do the testing, but we're not really the ones saying what am I trying to say here? So we're collecting the data, right? Let's say, I don't know, you take a test or you take some type of specimen. You're allowed to take the specimen. You're allowed to do the invasive measure, like let's say an in and out, right? Somebody is incontinent. You're not able to get a sterile urine sample from them. So you have to do an in and out. An in and out catheter is an invasive measure, right? But you're collecting the data, but you're not really the one who's saying what that data or what the result of the data is, right? So you are participating. If I'm understanding this properly, I would say it's a 50-50 for that as well. 8 is applying invasive techniques. So yes, we are applying invasive techniques. We are doing tracheostomy care. We are doing IVs. We are doing blood samples. We are doing catheters. We are doing all types of invasive things, introducing instruments into people's bodies. So yes, we are applying invasive techniques as LPNs as well. Participating in pregnancy care, deliveries, and postpartum care. So as an LPN, it is very, very rare that you will see a licensed practical nurse actually participating in deliveries, but you will see some LPNs postpartum, right? So that's a 50-50 as well. You're probably not gonna be in the delivery room while the delivery is happening. Usually you have to be an RN for that, but LPNs are definitely working in postpartum care. So 10 is providing nursing follow-up for persons with complex health problems. I would say yes, you are definitely providing nursing follow-ups, but that person may be seen by an RN before they're seen by you. So yes. 11 is administering and adjusting prescribed medication or other prescribed substances. So you are administering medications and other prescribed substances, but are you adjusting the prescribed medications? No, you're not doing that as as an LPN. I didn't even know that RNs could do that. So, hey, I just learned something. 12 is performing vaccinations as part of the vaccination operation under the Public Health Act. And this is written spot on, just like the LPN one. We are allowed to perform vaccinations as part of a vaccination operation under the Public Health Act. The only rule with that is that an RN or a doctor has to be in the building if you are performing or if you are participating in a vaccination operation, just in case somebody gets very sick or somebody gets a reaction, so that you can have some extra help, some extra supervision. 13 is mixing substances to complete the preparation of a medication according to a prescription. And once again, this is written in the LPN one. I'm going to read the LPN one for you guys. Mix substances to complete the preparation of a medication according to a prescription. It's exactly the same thing. So yes, we are doing that. And 14, making decisions as the use of restraint measures. So, like I said, if you're working in acute care, you are definitely not the one who's going to be making that decision. It will probably be made by an RN, and that's if a doctor is not present or if a doctor is not able to be reached, the RN is the one who's going to have to make that decision. But like I said, if you're working in a facility like mine where you are working independently, if you really see that somebody is an absolute danger to other patients or to themselves and it is absolutely necessary for you to do so, you'll probably try to call the doctor first. But if you're unable to get an answer, you may have to do it. So that is the real difference between LPN and RN. And all the ones that I said 50-50, it was because of either changing a prescription or making adjustments to a prescription, which, like I said, I didn't even know that RNs could do, and anything that is diagnostic. Because like I said, as a LPN, you are not doing nursing diagnoses, you are not doing assessments, you are doing assessments. It's very tricky. For those of you who are about to start LPN school, it may not make sense to you yet, but it will make sense soon to come. You are not really assessing, you are participating in the assessment, but you're not the one actually doing the nursing diagnoses. So when we look at every single thing that is in the activities of practice of a registered nurse, I would say out of 13 things, LPNs are allowed to do 11 of them. That is the difference. 11 of them. And the 2 things are related to diagnosing, or diagnostic tests, which is a big no for LPNs. So going back to the point, are LPNs glorified CNAs? If out of 13 reserved activities for registered nurses, LPNs are allowed to perform 11, and if you look at the CNA video, the CNA video, if you looked at part 1 of this video, you will see that out of the 13 things that LPNs are allowed to do, CNAs are only allowed to do 1 of their activities, which is taking vital signs. Are LPNs truly glorified CNAs? Once again, it is an absolute no. LPNs are not glorified CNAs. What we do is a lot more advanced, and this is not to bash CNAs. Like I said, I've worked as a CNA for 2 years while I was in nursing school. I have nothing against CNAs, but I really just want people to understand what the scope of practice, what the role of a licensed practical nurse is in the healthcare system, because a lot of people don't understand this. Even a lot of RNs don't understand this. And I think it's really important, because a lot of people are getting discouraged for no reason. A lot of people are about to start LPN school and they're extremely scared because they think that, you know, the difference between them and a CNA is not going to be great, and they were all excited about learning all these advanced nursing skills. So if you are about to start LPN school, you will learn advanced nursing skills. You will be a real nurse. You will be doing all types of super fun, interesting stuff. You will see a lot of fun stuff. Even if you don't participate in the delivery oh yeah, that's another thing, actually being in the delivery room. We don't do that, but I did get the opportunity to see a baby get delivered while in nursing school. And I did actually I was actually on a rotation for a week, I think, in postpartum care for pregnancy, where I was checking for lochia, where I was checking for all types of stuff, doing all types of nursing assessments on babies, on babies as well as the mothers, helping with breastfeeding, teaching how to breastfeed, all types of stuff. So don't worry, you will be a real nurse. Now I know this video was extremely long, and I'm really sorry about that. I just really wanted to make sure that this video was clear and that I got my point across. Once again, if you like this video, don't forget to like, comment, subscribe, and share. And I really hope to see you in my next video. Bye.